Betaseron, interferon beta 1b. Know how to inject Betaseron with confidence. Brought to you by Bayer Healthcare Pharmaceuticals and Betaseron. Please watch this video all the way through before injecting Betaseron for the first time, even if your doctor or beta nurse has already shown you how. You'll see ideas and tips that can really help. For detailed information on Betaseron, please see the important safety information, prescribing information, and injection training guide that comes in your Betaseron training kit. Here's what we'll cover. What to expect when you inject Betaseron. Preparing the syringe. Manually injecting with a syringe. Disposing of your used syringe. Injecting with the optional betaject lite. Answers to common questions. And real-time injection demos. Hi, I'm Kim. I'm going to show you how to inject yourself with Betaseron, also called interferon beta 1b, just as I was shown by my beta nurse, Sally. This video is meant to be a refresher, to be viewed after you've met with a beta nurse. So if you haven't had your one-on-one training yet, wait to watch this video and call Beta Plus at 1-800-788-1467 today. Using Betaseron is something I learned how to do, and you can too, once you have the know-how. I'm going to give you the highlights along with some helpful tips. Remember, there's no substitute for the individual training you get from your healthcare provider or beta nurse. After watching me, if you'd like more detailed instruction, you can refer to the injection guide in your Betaseron training kit. You can go to betaseron.com, and you can always call your beta nurse at 1-800-788-1467 anytime, day or night. So if you're like me, you may be nervous about giving yourself an injection the first few times. I can assure you, with the Beta Plus patient support program, you won't be going it alone. My beta nurse, Sally, came to my house and showed me, step by step, how to inject Betaseron. I'm pretty confident with it now. And I know Sally is always just a phone call away if I have any questions. But if it makes it any easier, a family member or a friend who's been trained by your healthcare provider or your beta nurse can also give you the injection. Or you can use the optional betaject lite auto-injector. It's great for those hard-to-reach spots like the back of your arm. Some people also like that it keeps the needle out of sight. To learn more, watch Rob in the section of this video called Injecting with the Optional Betaject Lite. Another thing I thought about when I started giving myself injections: would there be side effects? How would I handle them? Again, my beta nurse was there for me with information and good advice. For example, she told me that redness and swelling around where I inject are common side effects. I can help avoid them by correctly rotating my injection sites. The Rotating Injection Sites guide in your training kit makes it easy. It shows you 24 recommended places to inject Betaseron. I follow it to help reduce injection-related skin reactions and make sure I never inject the same site twice in a row. I use the dry erase pen that came with my training kit to mark the guide, so I always know where I last injected. If you're tech-savvy, Bayer offers a downloadable mobile app for your iPhone, iPod Touch, iPad, Palm Pre, BlackBerry, and Android smartphone called My Beta App. It lets you track your injections and get reminders about upcoming injections. To learn more about My Beta App, visit betaseron.com/app. If you have any questions about what to expect when injecting, you can always call your beta nurse 24/7 at 1-800-788-1467, even on holidays and weekends. Next, let's prepare our syringe. Before we start, it's important to make sure that your hands are clean. That means washing your hands with soap and warm water. Next, think about where you'd like to do your injection. I like the kitchen. Just pick a place where you have lots of light and a nice, clean, flat space where you can spread out a little. All the supplies you need are spelled out for you on the injection preparation mat, that came in your Betaseron training kit. First, take your Betaseron package, or if you were just practicing, like I am today, take out the placebo package, labeled Do Not Inject, and open it by peeling off the label. Next, place what you need on the prep mat. Alcohol wipes and a cotton ball you can get from your pharmacy. The betaject adapter with a pre-attached 30-gauge needle. The pre-filled diluent syringe. The vial containing Betaseron. The blister pack with the vial holder. The optional betaject lite, if you prefer the auto-injector. And a puncture-resistant sharps container to safely throw away your syringes. Remember, always check the expiration date and never inject the practice solution. So to begin, pick up the vial containing Betaseron, or if you're just practicing, the placebo powder. Using your thumb, pop off the cap from the vial. Place the vial upright in the round space on the back of the plastic package. This is to help keep the vial stable while you perform the next steps. Clean the top of the vial using one of the alcohol wipes. Wipe in one direction only so you don't spread any germs back and forth, and leave the alcohol wipe on top. Now, pick up the plastic betaject adapter pack and peel off the label, but don't remove or touch the adapter. It is important to keep it sterile. Next, remove the alcohol wipe from the top of the vial. Place the betaject adapter, still in the pack, on top of the vial. Push down like this, with your thumb and forefinger, until you feel or hear the adapter snap into place. You can now remove the plastic pack from the adapter. Grasp it by the edges and pull it straight up. Now you are ready to attach the pre-filled diluent syringe. Pick up the syringe while holding the clear plastic collar, and remove the orange cap by twisting it counterclockwise. Do not pull. Set the cap down. You can throw it away later. Remember not to touch the syringe tip or the end of the betaject adapter. It is important to keep them sterile. Holding the blue betaject adapter cap, connect the syringe to the open end of the adapter by carefully turning the syringe clockwise until the two pieces are connected. It shouldn't take much force. The syringe system is now assembled. Now pick up the syringe system. We are ready to mix the Betaseron solution. Holding the assembled syringe with the vial on the bottom, tilt it slightly to the side. Slowly push the plunger in all the way, transferring all of the solution from the syringe into the vial. Keeping it slightly tilted helps prevent bubbles from forming. Gently swirl the solution in the vial until all of the powder is dissolved. It doesn't take very long, usually less than a few minutes. Never shake the vial. It doesn't speed up the mixing and it can cause foam to form. If you do get foam, don't worry. Just wait for it to settle. Before you move on, check to make sure the vial is completely clear and doesn't contain any particles. If the solution is discolored or you see particles, do not use this vial and syringe. Start again with new supplies. Now, while keeping the plunger pushed in, carefully turn the assembled syringe over so the vial is pointing up. Now you can release your thumb from the plunger. This lets the solution flow into the syringe. If the solution doesn't fill your syringe past the 1 milliliter mark, hold the syringe horizontally and slowly pull back on the plunger until you pull all of the solution into the syringe. If you can't do that, it's okay. Start over with a new vial and syringe. Once you have the right amount of solution in your syringe, you need to get rid of any air bubbles that may have formed. Turn the syringe so that the needle cap is pointing straight up. Using a finger from your free hand, gently tap the syringe. This forces any bubbles to the top. To remove the air bubbles, slowly push the plunger to the 1 milliliter mark, or the mark for the dose your doctor recommended. Your doctor will tell you what dose of Betaseron to use, and that dose may change based on how your body responds. Many doctors suggest starting Betaseron at a dose of 0.25 milliliter every other day, and gradually increasing the dose over 6 weeks to 1 milliliter every other day. This process is called titration. For titration schedules, refer to your injection training guide or ask your healthcare provider. You should not change your dose without talking to your doctor. If you push the plunger past the recommended mark and too much solution goes back into the vial, return the assembled syringe to the horizontal position with the vial pointing up. Pull the plunger back a little to bring more solution into the syringe. Remember, you will still need to remove any air bubbles that are in the syringe. If you have to do this several times and you notice that the plunger becomes difficult to move, start again with a new vial and syringe. Okay, the last step before injection is the removal of the mixed-ject adapter and vial. This way you can be sure that the medication flows through the needle and not back into the vial. Turn the assembled syringe so the vial is back on the bottom. Hold the blue plastic mixed-ject adapter cap and unscrew it from the syringe by turning it clockwise. You can throw away the adapter cap and vial after you're done. Don't remove the needle cap yet. If you have prepared your syringe using Betaseron, you should let the syringe rest for a few minutes before you inject. Remember, you should never inject the placebo solution. It's for practice only. Make sure you dispose of your syringes prepared with the placebo powder in an appropriate sharps container. Betaseron doesn't have to be refrigerated. That's important if you travel. Once you have mixed your Betaseron, you should use it right away. If for some reason you can't, you can store the prepared syringe in the refrigerator for up to 3 hours. If you do this, make sure you let it warm up to room temperature before you inject. It should only take about 15 minutes. Never use a microwave oven or a stove to try to heat up the medication. If you forget and leave your medication in the refrigerator for more than 3 hours, start again using new supplies. Okay, we're ready to inject. Refer to your rotating injection sites guide. So now I'll be injecting in my thigh with actual Betaseron. Remember, never inject the placebo, which comes in a vial with a yellow cap. When you inject in your thigh, make sure your leg is relaxed and your muscle isn't tight. Start by cleaning the area with an alcohol wipe, moving the wipe in one direction only and then letting the skin air dry. When you're ready, carefully remove the needle cap by pulling it straight off. Don't twist it off. Once you do this, you should never try to put the cap back on. Gently pinch your skin together around the injection site to lift it up a little. Insert the needle into your skin at a 90-degree angle with a quick, firm motion. Inject Betaseron using a slow, steady push. Continue pushing the plunger until the syringe is empty and your injection is complete. You don't want it to go too quickly because the medication needs time to spread out under your skin. If blood appears in the syringe, it means that you have entered a blood vessel. Do not inject. Withdraw the needle and repeat the steps to prepare a new dose using a new syringe. Choose and clean a new injection site. Now carefully pull the needle straight out, apply a clean, dry cotton ball, and gently massage for a minute to help the medication spread out. Now that you've injected, you'll need to dispose of your used syringe and needle. Don't attempt to recap or reuse your used needle. Put the used syringe and needle in a proper sharps container for safe disposal. To request a free sharps container, please call Beta Plus at 1-800-788-1467. When the container is full, ask your pharmacist, healthcare provider, or beta nurse how to dispose of it. Different states have different rules for disposing of sharps containers. Do not throw the needle or syringe in the household trash or recycle. And always keep the disposal container out of the reach of children. That's it. Even though the process we just went through may seem to be a lot at first, with practice and a little help from your beta nurse, you'll get your injection routine down in no time at all. If you have any questions at all about Betaseron, call Beta Plus to speak with a beta nurse now. Next, Rob will show you how to use the optional Betaject Lite auto-injector.
Hi, I'm Rob. I'm here in my den. This is where I feel comfortable injecting myself with Betaseron, a medicine also known as interferon beta 1b. Let me show you how to do it. I'm going to demonstrate the optional auto-injector called the Betaject Lite. My beta nurse Carol showed me how to do it step by step, and I'm going to do the same for you. Before sitting down to watch this video, I really recommend that you meet with your beta nurse and have her show you how to inject in person. A one-on-one training session with your beta nurse is a terrific way to learn to inject and have your questions answered. If you haven't had your beta nurse training yet, call Beta Plus at 1-800-788-1467 today. I totally agree with Kim. Using Betaseron is something you can do once you have the know-how. So if you've already met with your beta nurse, watch this video and practice along with me now. Then, if you'd still like more detailed information, check out the injection guide that came in your Betaseron training kit. You can go to betaseron.com, and you can always call your beta nurse at 1-800-788-1467 anytime, day or night. I owe my confidence to my beta nurse, Carol. She's a great teacher and was very patient with me. Believe me, if I can learn to inject, anybody can do it. But if it makes it any easier, your beta nurse can train a family member or a friend to give you the injection. My beta nurse also helped me feel more confident about injecting by explaining what I could expect when I started giving myself injections. I asked her, would there be side effects from injecting? How would I handle them? Again, my beta nurse had answers and advice that really helped. She told me that injection site reactions, such as redness, pain, or swelling, are common side effects, and that I could help minimize them by correctly rotating my injection sites. The Rotating Injection Sites Guide in your training kit makes it easy. It shows you the 24 recommended places to inject Betaseron. I use the guide to help reduce injection-related skin reactions and make sure I never inject the same site twice in a row. Like Kim, I use the dry erase pen that came in my training kit to mark the guide so I always know where I last injected. If you have any questions about what to expect when injecting, you can always call your beta nurse 24/7 at 1-800-788-1467, even holidays and weekends. Because I live alone and inject by myself, my beta nurse suggested I use the optional Betaject Lite auto-injector to inject in those hard-to-reach spots, like the back of my arm. She was right. What I also like about the Betaject Lite is that it keeps the needle out of sight. Whenever you use the Betaject Lite, it's important to follow the steps I'm about to cover in the right order. The Betaject Lite can be separated into two main parts: the syringe holder and the injection body. The syringe holder comes with a standard orange 12mm tip already attached. The injector body is the part with the yellow spring and a release button. The 3 indicator windows on the side let you know when your injection is complete. After you press the button to inject, these windows will gradually fill with red. When the red in the window stops moving, your injection is finished. The whole process takes about 10 seconds, so you can just count the seconds if you are injecting into an area that makes it hard to see the indicator windows. Now, I'll show you how to use the Betaject Lite. Here's what you'll need for your injection: the Betaject Lite, your Betaseron syringe that you've already prepared, an alcohol wipe, and a dry cotton ball or gauze pad. Place the wide open end of the syringe holder on a flat surface so the orange tip is pointing up. Then, take the top half of the Betaject Lite, the injector body, and align the yellow spring with the orange tip of the syringe holder. Push down firmly on the injector body until you hear the spring click and lock into place. Then, lift the injector body up and away from the syringe holder. Be careful not to touch the release button. You can check to make sure that it's locked by looking at the windows on the side. You should be able to see the yellow spring at the top of the window. Once the spring is set, put the injector body aside. You should have a Betaseron syringe prepared by following the instructions you can see demonstrated in the section of this video called Preparing the Syringe. Go back to the main menu here if you need to see these instructions. Don't remove the needle cap just yet. Holding the syringe holder, just like this, insert the syringe with the capped needle going in first. The syringe wings should fit securely between the white plastic flanges inside the syringe holder, like this. Now, pick up the injector body and screw it clockwise into the syringe holder. Keep turning until it fits securely. Even though there is a built-in safety lock, be careful not to press the release button. If you drop your betaject lite with a prepared syringe inside, take the syringe out and discard it in your sharps container because it could be damaged. Start again using new supplies. Now you are ready to inject. Refer to your rotating injection sites guide to see where you last injected and choose your injection site. Today I'm going to show you how to inject the back of your arm. Be sure to clean the area with an alcohol wipe and let it air dry. Now, pick up your betaject lite. You'll see how the needle cap extends past the tip. Remove the cap by pulling it straight off. Remember, never twist it off and never try to recap the needle. When you're ready, place the tip of the betaject lite flat against your skin at a 90-degree angle. Gently push in on the injector body. You'll see the outside of the injector body move in towards the syringe holder. Keep pushing in until the injector body stops moving. This releases the safety lock. Your betaject lite shouldn't push too deeply into your skin. Don't press too hard, just hold it in place. When you're ready, you can press the release button to begin the injection. Be ready for a loud click when you press the release button. Listen. That loud click means the injection has begun. Keep holding the betaject lite against your skin and watch the indicator windows. They'll start to show red. It is very important to keep holding the betaject lite in place until the red in the windows stops moving. Count off the seconds. 1 1,000, 2 1,000, until you get to 10. Counting is especially important when you're injecting in an area where you can't see the windows. That way you know the injection is complete. It's red now, so you know it's done. When the injection is finished, slowly pull the betaject lite straight out from the injection site. You'll see the exposed needle poking out from the tip of the auto-injector. Be careful not to touch it. Put it aside. Now, take your cotton ball or gauze pad and gently massage the site for 1 minute. This will help the medication spread out. All done, except for cleaning your betaject and disposing of your used syringe. Rotate the injector body counterclockwise from the syringe holder. Now carefully remove the syringe from the betaject lite. Be careful not to touch the needle and don't recap it. And check to make sure that the syringe is empty and that you received your full dose of Betaseron. If you didn't receive your full dose, which happens very rarely, contact Beta Plus at 1-800-788-1467 and speak to a Beta nurse. Disposing of your used syringe and needle is easy. Place your used needle into a proper sharps container for safe disposal. When the container is full, ask your pharmacist, healthcare provider, or Beta nurse how to dispose of it. Different states have different rules for disposing of sharps containers. Do not throw the needle or syringe in the household trash or recycle, and always keep the disposal container out of the reach of children. If you need a sharps container, you can always order a free one by calling Beta Plus at 1-800-788-1467. Taking care of your betaject lite is simple too. Just wipe the tip and outside with a clean, damp cloth. The inside of the injector body should never get wet, but the syringe holder with the orange tip can be run under cold water. When you do this, leave the tip attached. Never submerge the entire betaject lite in water. Before you put the betaject lite back into its pouch, make sure each part is completely dry. If you follow these directions, your betaject lite should last for a long time. Injecting yourself may seem like a lot at first, but as I said before, if I can do it, so can you. And with your Beta nurse, you're never really alone. You can call and get support and advice any day, anytime.
When starting Betaseron, there are common questions many people have. I'll do my best to answer them for you now, but if you have further questions or need more information, be sure to call your Beta nurse at 1-800-788-1467. Let's get started. Disposing of used syringes. To dispose of your syringe, take care not to touch the needle. Check to make sure that the syringe is empty and that you received your full dose. Then, place your used syringe and needle in a sharps container. Don't recap your used needle. If you need to request a free sharps container, please call Beta Plus at 1-800-788-1467. When the Sharps container is full, your Beta nurse or pharmacist can tell you what to do with it, as the laws for disposing of Sharps containers are different from state to state. Do not throw the needle or syringe in the household trash or recycle. And always keep the disposal container out of the reach of children. Making injections more comfortable. Talk to your healthcare provider about taking an over-the-counter pain reliever about an hour before your injection. This may help reduce flu-like side effects such as fever, chills, and muscle aches. Properly rotating where you inject helps to minimize redness, pain, or swelling that may occur at the injection site. So, remember to mark your injection site in your personal journal to help you keep track of your injection days and sites. Finally, speak to your Beta nurse or healthcare provider about more tips to help make your injection experience more comfortable. Getting personal training. If your state law and insurance allows, you can get personal injection training from a Beta nurse. Your Beta nurse can make sure you are confident using Betaseron and can answer any questions you may have. Your Beta nurse is like having your own MS expert on call. To schedule a time for a Beta nurse to come to your home or doctor's office, call Beta Plus at 1-800-788-1467. Storing Betaseron. Betaseron can be stored refrigeration-free for over 30 days. After reconstituting Betaseron, you can refrigerate and use it within 3 hours. However, if you can't use Betaseron within 3 hours, it should be discarded and a new syringe should be prepared. Returning Betaseron to room temperature. You may not want to inject Betaseron if it is right from the refrigerator and cold. So, make sure to always let Betaseron come to room temperature after it has been refrigerated. This usually takes about 15 minutes. Traveling with Betaseron. The fact that Betaseron can be stored at room temperature makes it convenient when you're traveling. You don't have to travel with a cooler or need to keep it cold in a hotel room. However, if you do reconstitute Betaseron and don't use it right away, it must be kept refrigerated and used within 3 hours. When traveling, plan ahead. Here are some things to do when you're traveling with your Betaseron to help make your trip go smoothly. Carry a doctor's note on his or her stationery saying that you are living with multiple sclerosis and require injections. Take a current prescription label, located on the outside of the packaging, with you. In case you run out of Betaseron while traveling, be sure to have a doctor's phone number with you. Carry a durable container to put used needles and syringes in. Take your copy of My Personal Journal to keep a record of your therapy while you're away. Managing some side effects. There are many things you can do to help make some side effects more manageable. Your doctor may start you on a lower dose and then increase the dose gradually as your body adjusts to the therapy. This is called titration. Before you inject, take an over-the-counter pain reliever, such as acetaminophen or ibuprofen, as recommended by your healthcare provider. To help reduce what are called injection site reactions, you should always rotate your injection sites. Never use the same injection site twice in a row. If an area is sore, red, infected, or swollen, use another area and call your healthcare provider. Want to see what it's like to inject Betaseron in real time using a syringe? I'm about to demonstrate. It only takes a few minutes once you have your routine down. For the first few times you inject, be sure to review the chapters, preparing the syringe and manually injecting with a syringe. Ready for my real-time demo? Here goes. I start with the Betaseron kit. I take my vial, I pop the top, place it in the vial holder. Take an alcohol wipe, rub it in only one direction, place that on top. Here's my MixJect adapter, and press that down until I hear a little click. Pull that off. Next, I take my syringe and I twist the orange top off. Then I attach it to the vial. Only takes about 3 turns. And I pull it out of the blister pack. Next, I'm going to mix the two and I tilt it a little to the side so that I don't create foam. And I push the plunger slowly so that I don't get bubbles or foam. And when I have the plunger all the way down, I turn it upright again and I just swirl it. It doesn't take too much time, but you want to swirl it so you get rid of the foam. Swirl slowly, don't shake it because you get the opposite effect of what you want. And just a few more swirls, keeping the plunger held in. And then I turn it over and release the plunger and allow it to fill. And I'll give it a little help by pulling the plunger. And I fill the syringe to just above the 1 milliliter mark. And that looks good. Next, I test for bubbles, and it looks like there's just one perfect one in the middle. So I just push the plunger back up to get rid of that bubble right up to 1 milliliter. Perfect. And next I turn it upside down and I just pull the vial off. Great. So I'm almost ready to inject. I just mark off in my book where I'm going to inject. Today it's going to be my right thigh. And I take my alcohol wipe. It's my thigh. And I wipe in one direction. Then I'm going to take my needle, uncap it, just raise the skin a bit, and bring it in at a 90-degree angle. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Nice and slowly. And that looks good. Next, I take a cotton ball and I just rub it on the injection area just to spread the medicine out underneath my skin. It also feels good. And that's it. In time, injecting will be part of your routine and something you can do confidently for yourself. If you're nervous at first, remember, you can do it. It just takes a little know-how and it becomes as easy as that.
In just a few minutes, I'm going to demonstrate how long it takes to inject Betaseron using the Betaject Lite auto injector. You'll need to prepare your Betaseron solution, so be sure to review the section preparing the syringe first. Now, choose your injection site. I'm going to use my right arm. Get my alcohol wipe. I'll let that dry for a little bit. Take my injector and take off the needle cap. Put it at a 90-degree angle on my arm. Press up. Hit the safety switch. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000, 7 1000, 8 1000, 9 1000, 10 1000. Take my cotton ball. Rub the injection area and work the medicine around. Okay. And we're finished with the injection, so now I'm going to dispose of the needle. Take this off counterclockwise. Take your needle out. Be careful not to touch it. Put it in your sharps disposal. And you're finished.
Indications. Betaseron interferon beta 1b is a prescription medicine used to reduce the number of relapses in people with relapsing forms of multiple sclerosis, MS. This includes people who have had their first symptoms of multiple sclerosis and have an MRI consistent with multiple sclerosis. Betaseron will not cure MS, but may decrease the number of flare-ups of the disease. Important safety information. Do not take Betaseron, interferon beta 1b, if you are allergic to interferon beta 1b, to another interferon beta, to human albumin, or mannitol. Betaseron can cause serious side effects including liver problems, including liver failure. Symptoms of liver problems may include yellowing of your eyes, itchy skin, feeling very tired, flu-like symptoms, nausea or vomiting, bruising easily, or bleeding problems. Your healthcare provider will do blood tests to check for these problems while you take Betaseron. Serious allergic reactions. Serious allergic reactions can happen quickly and may happen after your first dose of Betaseron or after you have taken Betaseron many times. Symptoms may include difficulty breathing or swallowing, swelling of the mouth or tongue, rash, itching, or skin bumps. Depression or suicidal thoughts. Call your healthcare provider right away if you have any of the following symptoms, especially if they are new, worse, or worry you. Thoughts about suicide or dying, new or worse depression, sinking feeling or sadness, new or worse anxiety, feeling uneasy, nervous, or fearful for no reason, trouble sleeping, insomnia, acting aggressive, being angry or violent, acting on dangerous impulses, hallucinations, or other unusual changes in behavior or mood. Other possible serious side effects with Betaseron include heart problems. Betaseron may worsen heart problems, including congestive heart failure. Symptoms of heart problems may include swollen ankles, shortness of breath, decreased ability to exercise, fast heartbeat, tightness in chest, increased need to urinate at night, not being able to lay flat in bed. Injection site problems. Serious skin reactions can happen in some people, including areas of severe damage to skin and the tissue below the skin, necrosis. These reactions can happen anywhere you inject Betaseron. Symptoms of injection site problems may include swelling, redness, or pain at the injection site, fluid drainage from the injection site, breaks in your skin, or blue-black skin discoloration. Change your injection site each time you inject Betaseron, as it will lessen the chance of you having a serious skin reaction. Avoid injecting Betaseron into an area of the skin that is sore, reddened, infected, or has other problems. Flu-like symptoms. Betaseron can cause flu-like symptoms including fever, chills, tiredness, sweating, muscle aches when you first start to use it. These symptoms may decrease over time. Taking medicines for fever and pain relief on the days you are using Betaseron may help decrease these symptoms. Seizures. Some people have had seizures while taking Betaseron, including people who have never had seizures before. It is not known if the seizures were related to MS, to Betaseron, or to a combination of both. If you have a seizure after taking Betaseron, call your healthcare provider right away. Blood problems. You may have a drop in the levels of infection-fighting white blood cells, red blood cells, or cells that help you form blood clots. If drops in levels are severe, they can lessen your ability to fight infections, make you feel tired or sluggish, or cause you to bruise or bleed easily. Risk to pregnancy. Betaseron can harm your unborn baby. Betaseron may cause you to lose your baby, miscarry. If you become pregnant while taking Betaseron, call your healthcare provider right away. You and your healthcare provider should decide if you should continue to take Betaseron. Most common side effects. The most common side effects of Betaseron include low white blood cell count, increases in your liver enzymes, headache, increase in your muscle tension, pain, rash, problems sleeping, stomach pain, weakness. These are not all the possible side effects of Betaseron. Tell your healthcare provider if you have any side effects that bothers you or that does not go away. Tell your healthcare provider about all the medicines you take and your medical conditions. Please see the full prescribing information and medication guide for additional information and talk to your healthcare provider. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.